Green Star Social Marketing Pakistan welcomes the audience to this 90-minute session titled Women Leaders Advancing the Sexual and Reproductive Health Services, Quality and Rights in Pakistan. Ladies and gentlemen, this is for us a very unique time, and for all of us to be online discussing SRH, quality and rights. The reason is that, like the rest of the world, we are also grappling with COVID-19. Today, Pakistan's tally crossed China's 4,600 cases reported in the last 12 hours. Total of 103,000 cases, and the government is under tremendous pressure to restart the lockdown. Well, it is a challenge getting 208 million people to observe effective social distancing and getting on with life to avoid economic meltdown. It's a challenge. So like many of the underdeveloped countries, most of our problems are imbibed in population, as you are aware. And you are special because all of you out there who found time today must feel good about themselves. Because by doing this, you have actually declared that amidst this chaos of COVID, life has to move on in parallel. And before we start our session, I would like to thank International Leadership Academy. In the same spirit, the Green Star, the panel from Pakistan, I think it is the only country panel in the conference. We would like to pay our tribute to International Leadership Academy for providing this platform for hosting a dialogue at a critical time when everyone is preoccupied with COVID. One day it would be over, and while that happens, someone has to keep an eye on other critical issues like women's health. The path is self-chosen, ladies and gentlemen. Journey continues until destination arrives, and defeat is not an option. Very briefly, I'll introduce this topic to you, is that we are going to be discussing today. We need to understand that sexual and reproductive health is a fundamental human right. It is fundamental means of achieving any developmental goal, such as poverty reduction, improving long-term health. So achieving sexual reproductive health and rights is dependent on recognition of a specific human right. In order to understand the ecosystem, we should know that in Pakistan, human sexuality, reproductive and sexuality and reproduction is a choice. The subject is of strong ideology and moral values and traditions often presented as a part of religion. Therefore, many women and young people in Pakistan face the barriers, and these barriers prevent them from exercising these rights. So when we deny these rights, it results in grave consequences such as exacerbation of poverty and inequality. It also leads to vulnerabilities of gender-related ill health, unintended pregnancies, maternal deaths, harmful cultural practices, sexual and gender-based violence, evident from its high maternal mortality, adolescent birth rate, unmet need for contraception. Ladies and gentlemen, many Pakistan's women have dared to break the conspiracy of silence about these issues, about the unequal relationship between men and women. They have pursued movements and strategies for acquiring rights, not only for women, but for everyone facing inequality. Now, why are we, Green Star is hosting this conference and this panel? Like all governments around the world, Pakistan as a nation is overwhelmed with COVID, and that's nothing surprising. Public sector health systems are still either closed or operating suboptimally. Crisis sucked out of the government's resources, our essential maternal, newborn, and health, gender, reproductive health resources. Green Star represents an intra-community ecosystem that revolves around women in Pakistan. Women are at the center of the entire family. The family is the basic structural unit of any society. So under siege, COVID lockdown has created severe physical, social, economic, psychological challenges for women in Pakistan. And this is very important to set the stage. Private sector is the only hope probably for preventing maternal and child health from going back to burners. Women leadership needs to be celebrated, cultivated, and charged. It's a women's issue, so who else would be in a better position to lead this issue? Women of Pakistan. So we need to clone women-centered leadership in Pakistan, empowering women to take charge. UNFPA warns us that till December, lockdown, 5 million babies are expected on our shores. Simultaneous increase in the unwanted pregnancies, hemorrhages, sepsis, and death. Therefore, maternal and newborn mortality and morbidity. It will drastically increase unmet need, sexually transmitted infection, gender-based violence, and the one single point agenda amidst COVID chaos is to prepare and protect service providers and ensure zero stockouts of FP and RH commodities. Ladies and gentlemen, to set the perspective, it is very important to see what we are talking about, because I may go on introducing. So there is a small video we have put together. There are 2 videos in this session to set you the perspective of where we come from. I can't hear the sound.
Sana, you're going to need to restart it and you need to share your sound. Dr. Saeed, perhaps we can go to the first panelist and we'll come back to the video.
I think this is a very good idea. Ladies and gentlemen, let me introduce my panelists today. We have put together a constellation of people who have contributed a lot over the years. My very first panelist is going to be, who is also the chair of the session, is Dr. Yasmin Sabi Kazi. She's an experienced medical graduate and with diverse public exposure of public health, and was often invited as expert on national task force for donor liaison, programming, and policy making. She is currently the senior advocacy consultant to Bill and Melinda Gates Foundation on family planning, a leading reproductive health expert in the country. She has remained an active advocate of women's health issues through her association with civil societies for more than 25 years. She works very closely with donors and NGOs on reproductive health matters in country and internationally. She is acknowledged for her contribution and leadership. A notable one was invitation to speak to the British Parliament on the status of maternal health. My next senior speaker is going to be a public office holder, senior panelist, Dr. Shabnam Sarfaraz. Dr. Shabnam Sarfaraz works at the Ministry of Planning and Development and Special Initiatives as leading National COVID Secretariat at Planning and Commission, Government of Pakistan. Dr. Shabnam is also visiting scientist at the Department of Global Health, Population, Harvard Global Health Institute. After that, we will have another doctor with us, Dr. Qudsiya Uzma, who is National Professional Officer, Maternal, Newborn, Child and Adolescent Health at WHO Country Office in Pakistan. Last but not the least, youngest panelist, Lareb Abid, who is the founder of the executive director of Mashal, Making a Society Healthier and Lively. She is named among 120 under 40 leaders by Gates Institute. Ladies and gentlemen, Our session today is going to be in three parts. We are first going to have, and these three parts are how, what, and whys. In each session, how, what, and why, while we'll be discussing women leader advancing the sexual and reproductive health services quality and rights in Pakistan, each speaker is going to deliberate for 5 minutes per questions. Now, let's start with the what session. I'll start with Dr. Kutsia. This had been perspective. We could not, unfortunately, we didn't see the video that could have said prepared. Dr. What has been the history of women's rights, particularly sexual and reproductive health rights movement in Pakistan?
Thank you, Dr. Rab, for the introductions, and thank you for inviting me to this panel. I'm really delighted to be part of this exciting discussion today and to be able to share the gallant history of Pakistan in SRHR movement led by women in my country. It makes me really proud to say that we have a long list of audacious and outstanding Pakistani women who have played a very significant role in advancing women development and empowerment, including sexual and reproductive health. On this screen, you can see I have tried to put together a timeline to show how it goes in terms of the history of our country. The advancement of sexual and reproductive health in Pakistan, in my opinion, has begun with the women rights movement. In the early period of Pakistan's history, the struggle for women's right, of course, was quite gradual and evolutionary. And as you can see, immediately after its birth, we had Madam Fatima Jinnah, the sister of our founder of the nation. And then we had Pakistan's first Prime Minister's wife, Begum Rana Liaquat Ali. These women had been really instrumental in laying foundation of a large number of women's organizations that have supported women empowerment. The most famous of these is the All Pakistan Women's Association, APWA. And then there were so many other efforts that have, especially welfare and legal reforms that have contributed to the SRHR movement. And along the timeline, there was also a very significant association that is called Family Planning Association of Pakistan, which was started, and it has held the reproductive agenda high on health issues in the country to date, and this organization is really working really great. As you can see, in the 1960s, we had the Muslim Family Laws Ordinance, and it basically gave women rights with regard to marriage, custody of children, divorce, registration of marriages and divorces, and all that. And it was basically during the same era. Then Pakistan also launched its family planning program. It was basically the pioneer in the whole region, and it was a real good hallmark program for the country. Likewise, during 1960s and 70s, many women organizations were also working to promote welfare and economic empowerment of women in the country. I can't name all of them, but this movement had already had a momentum built around this. In 1970s, women in Pakistan witnessed a new era in the developmental history. They voted in the general elections for the first time, independently of their male kin. And all government services were also open to the women through administrative reforms in 1972. And according to that, women were then able to enter many of the services which were by that time were not sort of available to them. These included foreign services and management groups and likewise. Then women were also given the opportunity to become prime minister or governor or cabinet minister. And subsequent to these instrumental reforms, many women leaders gained significant roles in government functionaries in that era. And we had Begum Rana Liaquat Ali, who became the governor of Sindh province. We had Kaniz Yusuf, who became vice chancellor of a university. And we had Begum Ashraf Abbasi, who was elected as Deputy Speaker of the National Assembly. So these were really big achievements for women of the country in that time. And this basically was laying the foundation for more instrumental gains in terms of SRH movement. I would like to emphasize here the wonderful contributions made by the 1973 Constitution of Pakistan by acknowledging the number of inherent rights of women in terms of equality of all citizens before law, non-discrimination on the basis of sex, non-discrimination on the basis of race, religion for appointment in services of Pakistan, reservation of seats for women, and also protection with regard to family and mother and child. Unfortunately, following the Afghan crisis in 1979, Pakistan came under martial law, and then it faced a lot of radical and mostly false articulation of the religion. And that actually led to putting Pakistani women under undue pressure to remain compliant to the main dominant societal norms. However, it was very fortunate for the country and the women of the country that a democratic government succeeded that martial law in 1990s, and it rejuvenated the women's rights movement. And it actually helped in enforcing various women-friendly measures in the country. In 1990s, the Pakistan government revised the colonial era penal code with respect to abortions, and the revisions basically sought to conform better to the Islamic teachings. Then, as we all know, Benazir Bhutto was the first woman Muslim Pakistani prime minister, and having her as the leader of the country helped gaining huge respect for Pakistani women in the global society. She was instrumental in conceiving and launching the flagship Lady Health Workers program, which all of us are aware, and many people across the globe know that program as a trendsetter, and it has basically helped other countries to also replicate similar programming at the community level to support and meet the SRH needs of women through community mobilization. Benazir Bhutto also represented Pakistan at the 4th World Conference on Women in Beijing in 1995, which led to Pakistan acceding to the Convention on the Elimination of All Forms of Discrimination against Women. So having her in that key position really helped the country in accelerating the women rights movement. During the same time frame, various other NGOs had also been working, and during the last 2 decades, as you can see on the timeline, the country has had a huge number of women leaders. I just can't put all the pictures on this timeline, so you can see some key faces there. But we have had really strong and very influential women leaders all around us, especially right now for the last few years. This SRHR movement has really been strengthened, and we can really witness remarkable improvements. In terms of whatever women rights can be promoted and advocated for. However, we'll be talking more about what are the challenges and issues that are still remaining in terms of implementation and getting the desired outcomes. I'll stop here and hand over to the moderator. Thank you.
Thank you, Isma. Thank you very much for giving us the roller coaster ride across Pakistan over the timeline. Now, I'll come to Dr. Yasmin Qazi now. Dr. Qazi, looking at the history of how women in Pakistan have struggled to get their rights, and as there have also been quite substantial achievements, it's not that gloomy. So through the prism of your own journey, what has been your personal journey to ascend as one of the top women leaders in the country who has worked in sexual and reproductive health and family planning field?
Thank you, Dr. Aziz, for starting with the high compliments, and thank you, Kutsia, for putting me as one of the top leaders in Pakistan in your picture. It was very flattering. Yeah, it is a journey. It's always a journey, And when I was listening to the first session of this conference, and there was a question: are leaders born, or are they nurtured? And the speaker said that it's a combination. Sometimes leaders are born, and sometimes you're nurtured. I also feel that as I'm a medical doctor. I was getting trained. So a very brief my journey. I was being trained as a general surgeon, and at that time there was only one female general surgeon in Karachi, Dr. Kishwar Nazli, and she would say, "You'll be the next Kishwar Nazli of Karachi." And I loved surgery, and that was my passion. But then I had my eldest son. I had to take a mini break because surgery is so demanding. And I entered into family planning and sexual reproductive health like a mini break. Okay, let's do it for 2 years and then, go back to what we are doing, what I was doing before. But when I came to this field, it was a reality check to me. I went to a village. I took a mobile cam with me as a provider. And when I met women there, and when I heard their stories, it was like, oh my God, the women are so disempowered. They can't even take a single decision about their own health, about their fertility, about the number of children they want. And I became so passionate about how to work on the women's rights issue as far as health and family planning is concerned, that there was no turning back. I never went back to surgery. And then, of course, I do my public health and all that. So that was my personal story. So I really feel that if, as a women leader, we want to bring a change, you have to have a passion for it. If you have a passion, if you have a commitment, if you have a focus, then, you are not deterred by the challenges. There are several challenges. There is a system in which we have a male patriarchal society, but overall globally, there is a system that will push you back, especially if you're a young, aspiring woman who is bold, who can take positions, who can just interact on difficult issues. So, you have to make your space. But I think the determination, the consistency, and then you have to believe in yourself. Okay, this is what I believe in. This is my passion. And if I want to change the life of women that I'm getting in touch with, then I have to remain, I'm not going to be, stepping back because somebody is pushing me. So people would make all kind of remarks to me, working on sexual health, working on abortions, working on family planning. These are contentious issues throughout the world. So they feel that why I'm wasting my wisdom and my, education on something that may become controversial. But the belief in it, I think, led me to where I am. And I think that's the kind of a trajectory that when the young people come to me and ask, and there is one very common question that people ask me is, how have you balanced your personal and professional life? Because young girls also find it a big challenge. So I think believing in yourself, not moving away from the focus, and then, keeping the trajectory and taking the opportunities. So where there are opportunities, you take that opportunity and you see that there's going to be a gain in it. So I think a lot of gains that we have made in Pakistan in family planning and in SRH field has been due to the fact that the women leaders have been able to raise a community. They have been able to, do it together. They have been like, come as a, and they try to influence other policies, but they also try to influence and try to mentor the young people coming, because that's going to be very important. We can't be sitting here all our life and think that, we are the one who did the change and we are. So I'm a great supporter. I'm very happy Lareb is here. I will not take away her talking points. I will not talk about but I'm a great believer in investing in young people, because I was young when I was stepped into this field, and I know that what kind of challenges I did face. But I say one thing, that if you want to make a change and if you are convinced that this can happen, it will happen. So I think that belief and that conviction, that support, of course you need support. And of course you also need to be strategic. You should know what you're talking about. you should have the right kind of a frameworks with you, having a strategy, having a framework, taking the opportunities, trying to, you know, have good relationship. It's not about, some people say, oh, you're feminist, so you're always maybe locking horns with everybody like the government and others. No, it's not about that. It's about how do we make allies and how do we take people with us. And it's not about,
now,
you know,
if you allow me to turn the focus slightly differently, because we are talking to an international audience, and very briefly, if I ask you, what do you think is the current status of gender equity and inclusion of women in decision making before we move on to the local scenario? So what is the current status of gender equity and inclusion of women in decision making in Pakistan?
I think the goal of gender equity is still very far in Pakistan. So I will not fool anybody by saying, oh, we have done. But like, you know, very nicely, Qudsiya has already summarized. We have seen some unusual, you know, kind of outliers, women leaders in Pakistan, having first women prime minister in Muslim country, having first state, you know, bank governor in Asia, a woman, you know, so, and having a speaker, a first woman speaker in National Assembly in Asia. So, you know, we have created those kind of an example. So I would say that it is becoming better, but we say, oh, there is a lot of gender equity in Pakistan. It would be just deceiving ourselves. But what I'm saying is that we have example, we have evidence that if you give opportunities to women and if you support them as leaders, they are the change makers. They are the one who can do it. So the gender equity is not like anything near desirable that we would want, but we are not giving up and we are moving there, and we know that we can at least reduce the gap.
Fantastic. I think after Qudsiya's timeline and your first personal example as an angle from which we can look at Pakistan, we will give it one more try to understand the perspective, and I'll request Sana to let us have the Pakistan perspective. Can you play this video, please? Yeah.
With over 90,000 with countries abysmal health engineering indicators, the fragile healthcare system. This pandemic has exacerbated barriers to sexual and reproductive health and rights for women and girls. This is the home-based clinic of Amina Saleh, a community-based service provider. She is one of the many young girls trained by Green Star Social Marketing, successfully leading and spearheading service delivery programs for women in her community. As a frontline defender in these crucial times, Amna is bridging the gaps in reproductive health for women in her community.
कराची में तकरीबन 70% लोग प्राइवेट सेटअप की तरफ जाते हैं। जैसे कि कोरोना वायरस की वजह से हालात ऐसे हो गए हैं कि लोगों को वहाँ जाना बहुत मुश्किल हो गया है। हॉस्पिटल में जाने में लोगों को कन्वेंस वगैरह नहीं है, लोग वहाँ तक नहीं जा सकते।
हमें कोरोना वायरस से क्लिनिक बंद डॉक्टर ने मैं डॉक्टर आमने के रखाई पेशदारी में चुका था पे अच्छे मसले भी ममता का ही पेशदारी मारा पास बस फायदे मैं कोरोना वायरस का डॉक्टर आमना हमारा समझाएंगे सिफारिश करने जरिसी बच्चे ने चुपने जस मस्ता शुरू थे अच्छे लोग के मर्दों में सजना समझाएंगे हमारा बात समझाएंगे।
आज मैं इस मुकाम तक पहुंची हूँ, उसमें मेरी माँ का हाथ है। उन्होंने मेहनत की है जो मुझे इस मुकाम तक पहुंचाया है। मैं फ़ख्र महसूस करती हूँ कि मैं आज अपने एरिया की एक मकबूल डॉक्टर हूँ और इसमें मेरा साथ ग्रीन स्टार ने दिया है। ग्रीन स्टार ने मुझे ऐसी ट्रेनिंग्स दी है जिसमें मेरी हिम्मत बढ़ी है, मुझ में कॉन्फिडेंस आया है।
तो फ़ख्र है अपने बेटियों पे जो डॉक्टर बन गए, सब पब्लिक पे खिदमत करते हैं, यदि किसी का दुख सुख में काम आते हैं, मेरे को बहुत फ़ख्र है। हमारी ज़िंदगी का कोई भरोसा नहीं है, अपने लिए कुछ करें। इसलिए मैंने इस लोग को लिखवाया, पढ़वाया, मेहनत किया इस लोग के ऊपर कि अपने पाँव पे ये खड़े रहे।
मैं अपनी ये जिम्मेदारी समझती हूँ कि मैं अपने मुल्क की ख़वातीन के साथ इन हालात में भी खड़ी रहूँ, उनकी हर तरह से मदद करूँ। मेरा क्लिनिक 24 आवर्स खुला रहता है, तो अगर इन हालात में भी मैं उनकी मदद नहीं करूँगी तो और कौन करेगा।
Amna is a hero without a cape, sustaining the primary healthcare needs of women in her community and bolstering the primary healthcare system during a global public health crisis. She is a true leader, inspiring a better future.
Thank you, Sana. I think the most important element to understand here is that on the international forum, we wanted you to feel Pakistan. This is the true Pakistan. And the leaders are going to come from within. We have to help local community ecosystems identify from talent within. All we need to do is to connect and unleash the tremendous potential by creating awareness and by creating enabling environment. Now that leads me to my next speaker, Dr. Shabnam Sarfaraz. Dr. Shabnam Sarfaraz holds public office. So I think in this scenario, when we have seen a bit of Pakistan, we have seen the timeline, we have seen the reasons of struggle, and we have also seen one journey from the community and one of the leaders. Dr. Shabnam, women have struggled hard to get the policy leadership and the senior government positions in Pakistan. What is your perception about it? What challenges did you encounter during entry of this leadership journey as you occupy one of the senior most positions in the government office? What were your challenges, Dr. Shabnam? Dr. Shabnam?
Please unmute the mic.
Oh, okay.
Yes.
Thank you so much. Well, things for us to have.
The sound is missing. Dr. Sab, can you connect again?
Can you hear me now?
Yes, 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 yes. You're back again.
Oh, thank you.
You're gone.
Well, things for us don't come that easy. Work-life balance, as Yasmin. So, can you hear me now?
Yes.
Can you hear me? Okay. The work-life balance, Yasmin has already talked about, is a continuing challenge, which you have to get better and better if you have to climb up the career ladder. That is something, a skill that you have to, excel at. Like all of us, I have faced many downfalls, but somehow benefited from the resilience to get up for what I firmly believed in, pushing the limit and learning from every failure. I think that's important to look at failures as a learning platform. I think I benefited because in my career journey, as I sat on almost all sides of the table, from the military, the private sector, the public sector, from regional to international roles, with development partners, international NGOs, from clinical practice to policy tables. This diverse experience not only brought a far more granular understanding of the sector I was operating in, but helped me get ahead of the game by unveiling the challenges that I felt deeply connected with. I was able to align. I was lucky because I was initially in clinical practice, and I was able in this course align my work with my passions. And when this happens, this gives a purpose to the work that you're doing, and the game changes altogether. The work doesn't seem like work anymore, really. I picked work as I moved along, which majority thought that was a waste of time because a lot of people had attempted it. It was important, but there was little hope that we would be able to move ahead. So these were large reforms which always, attracted me. And also when I worked on them, it was always with the conviction of turning things around. I was fortunate to have good teams. building systems, local capacities, and resilience, and bringing the much needed policy reforms, I feel I've always felt are important for sustainable outcomes. And that is what kept me going and got me to, move to where I am in the government, because that is certainly the platform where we are able to do, we are able to make the difference that we try and tried, which we had dreamt for, and had been struggling for all the way along.
So if I could ask you, if you can let us have a window into the challenges in our society that you faced, because there are a lot many like Amna who are out there. You were those fortunate who made it up to certain points. So what were those challenges, if you'd like to share with us? What were these factors that facilitated you in getting you where you are today in your ability and able to make a difference in the lives of so many women around in Pakistan?
If I look at the facilitators, I think there is, this constant pursuit for excellence. That is something I strongly feel that we have to do things differently if we want to see different results. And again, I think I benefited hugely by patronship of kind, compassionate mentors all the way along. I had powerful sponsors. You need sponsors as you climb to these, highest echelons. And what these sponsors do actually is that they put you through demanding, stepping stone jobs and assignments that not only brings credibility to your work, but also brings visibility at that level. Another facilitator, I think, for women like in my circle, I think because we come from a society where we still have a lot of responsibilities. No matter how higher we climb up the career ladder, is the support of what I call my kitchen cabinet. And that is not only at home, my friends, my people at work. And this kitchen cabinet is something I would strongly, and everybody has those, support systems. It's just a matter of organizing yourself, building and nurturing those relationships, because you need that support all the way throughout, when your children are young, when you are traveling, and when you are, doing these assignments where it becomes difficult to, do the work-life balance. So I personally think that is something which I highly recommend, to a lot of my mentees who are out there.
So just to sum it up, if you were to, some of the key lessons in your journey, by the way, Dr. Sana Darwesh has just now put up the videos. For those who could not hear it, you can click on that and later on find out what is the Pakistan's perspective. Dr. Shabnam, what have been some key lessons learned in this journey in now that you are able to make life easier for other people? What were the key lessons along the journey?
Those who have worked with me, I do confess that I do move at a speed which is uncomfortable for a lot of, team members around me. Somehow, deep inside, I somehow believe that if we continue to work at a pace that we have moved on for decades, it will take us centuries to make the changes in the landscape that we are wanting to see. But that does get frustrating, to people who are around you. But then it's the opportunity window that you want to exploit when you are at such positions. The trick here and the lesson which I've learned, which has helped me, is to the survival and ultimately leading to success, is to identify high-power teams who share the same passions and are willing to travel with you on this journey, which is challenging, but yet equally rewarding. Without these teams, you cannot make these bigger impacts. So I think it is important to, pick your team members and, build these teams and empower them so that you are able to, do these larger projects and to work on a much larger scale, I would say.
Fantastic. Fantastic. Thank you very much. Now I'd go to my last but not the least speaker, Lareb. Lareb Abed, where are you?
I'm here.
You're the youngest woman leader on the panel. You are the new Pakistan. So Lareb, if I may ask you, what has been the single most important achievement and the challenge as a young woman leader in your personal journey. Would you like to share that with us?
Sure. First of all, thank you very much for calling me and providing this platform. I think this is one of those examples that we say that young people need to have. Okay, before starting the achievement story or the personal story, I'll definitely reflect on the challenges because this is International Leadership Conference, and I'll definitely throw a light on how and why certain people who have those qualities are actually not going to that path. So I think there is a general attitude of our universities and students that they usually go for job seeking and not actually the job making process. So this is where you are just told that, just be a teacher, be a doctor, be an engineer, get a good job, have a good security, just, have a government seat and your life's all set up. So this is something that majority of the students are looking to. So how come they will lead something? How they'll think that this is a problem that they can solve if they're all, life is full of this goal of getting this one job security. So I think it's really important as our expert panelists share their experiences, because it's been years and years that they're working, but it's just few years that I left my university, and I've seen people who had the skills, but they were told to just, go and do a job. Now, there are two reasons why this happens in the university. Number one, there is lack of learning environment, I would say. You just cram the books, there's no practicality, and you just, the race is all about getting the highest GPA or the score and, just coming back. And when you go for the internships, the environment in the organizations are not so much, I would say, impactful for the young students. So when they're actually going to the jobs and when people ask them to do certain skill, they are unable to do that. Even if they have leadership qualities, they do have to learn some skills, of course. So this is something that actually distort. One of the most important second point is patriarchy, of course, because if I'll talk about women as students, of course, they are seen as homemakers. Of course, they are seen as studying for the good rishta, or a good soulmate, for a good life partner, and that's it. So, you see the long-term goal for the young people are just too vague or just too specific, that I see a lot of people who have their talent, but of course they are not into that point. And then in this way, I'll also come to my journey. We are three sisters, and I've seen people asking my mom, why you don't have a son? Why you don't have a son? Why you don't try for a son? And she's always like, these three daughters are my three sons, and I don't want to have a son. So I've seen, happening this since I was a child, and when I had no idea that this is how society is operating. So when I started working on such issues, I'll share a brief journey. So one day, one of my friend actually called me. I share this everywhere because that's an inspiration to me. And she asked me that, Lareb, you have a lot of doctors in your family. So fortunately or unfortunately, I have a lot of doctors. So coming to a non-medical field was also a challenge. But then she asked me that, just connect me with some doctor, and I want to have some advice on not having my third child. So I was a bit curious that you have two kids, and how come you have no idea about, family planning methods and issues? I was a bit surprised because, of course, she is an engineer. She lives in a metropolitan city, and that's what we think, that people have knowledge about it. And she told me that there is no platform where I could say that, I could go and look for the opportunities or the facilities that I have around me. I was like, you can simply Google it, because everything that comes to young people are like, just Google, Google, Google. And then she tells me that when I Google, the information is either, scattered all over the place. And then I'm not a bit sure that I want to, do that if it's, religious or moral or practical in Pakistan. And then I have a lot of confusions if it's authentic or not. Then I told her, why don't you call to the telehealth services that we had? And she was like, where are the numbers? So these were the questions that I also actually, I'll answer it later on the next question, but there's a point that I'm saying. So I just saw a challenge, a problem, and I just thought, why I don't create a solution? I thought it when I thought that I wanted to do something by my own, when I thought that it's not important to do something 9 to 5. And that's because only of the reason that there were certain mentors like Ma'am Yasmin, that I call them angels, because of course they gave us a path, they gave us the courage. There was someone who told me that, the job is not everything. So the biggest challenge that I always have and the students have is that they are not told to, be an entrepreneurship, be an entrepreneur, to go in entrepreneurship and create solutions, because they are the present and they know the best solution that young people can engage into.
Fantastic, fantastic. I think it has been a very interesting snapshot of the past, the current situation of women leadership in sexual and reproductive health in Pakistan. I would now request the panelists to take us through the strategies that were employed to advance sexual and reproductive health in Pakistan by women leaders, while simultaneously advancing the women claiming leadership role. Now, the second portion, as I introduced in the beginning, is about how the strategies. And in this, I will come to Putsia. Dr. Putsia, if you can, how's the development, country's development linked to the sexual and reproductive health? Is there a link between Pakistan's performance on SDGs with the situation on SRHR? Putsia?
Thank you, Dr. Aziz. And I would, of course, the answer is definitely a yes, that the country's development is linked to SRHR. Sexual and reproductive health and rights are important pillars of human rights framework. And if we look at the below average performance of the country in terms of its economic development, or even the global development frameworks like SDGs, there is a great contribution of issues around SRHR in particular, and in general around the other human rights that lead to such situation in the country. We are aware that SDG 3, which focuses on health, has been globally translated into a global strategy on women's, children's, and adolescents' health. And this strategy basically has a very clear focus on SRHR, and it keeps, for the first time globally, adolescents at the center of the strategy for, in this global developmental agenda. Pakistan is the 6th most populous country in the world, and we have a prominent youth slot in our population pyramid. However, SRH, sexual and reproductive health and rights, concerns of the population, particularly the youth segment, they have largely remained unaddressed at both the policy and the implementation levels. Among the key factors behind countries' slow performance on overall developmental platform, or especially if we talk about SDGs, some of the key factors include socio-cultural hesitation to talk about sexuality as it is seen as a taboo subject. And consequently, it basically restricts people's choices in this regard. And also there are so many, Dr. Yasmin was referring to the gender equality issues, and these issues are also at the foundation of the unequal power relationships between men and women that sort of results in making it more difficult for girls and women to have autonomy on about their own reproductive health and about their lives. Equally important is the fact that government is, of course, facing challenges in ensuring the desired increase in the overall spending on health. Currently, it's less than 1%, and WHO recommends it to be at least 5% of the GDP in order to make reasonable progress on universal health coverage, and to be able, for any country to be able to achieve the set targets under the Sustainable Development Goals. Unfortunately, Pakistan is basically in such a geopolitical situation that it has been exposed to so many conflicts and disasters, and then it gets very much complicated and compounded with the governance issues, and likewise that basically it finds it hard to make to enhance the public spending on health. However, there is a window of opportunity. Dr. Aziz, you were mentioning about the private sector, and we have a very vibrant and dynamic private sector that is really contributing so high to the sexual and reproductive health advancement in the country. Green Star social marketing is one of a prominent actor. We have so many more as well that are also contributing together with the Green Star. We have IPAS, we have Maristopes, and so many more. We are also, and these organizations have been really successful in making SRHR a prominent feature on the overall health premise. And it's now the success, I can really relate it to the success point that key SRHR interventions have basically found their place within the recently finalized essential services package in line with the disease control priorities 3 that the government of Pakistan has finalized. And key SRHR interventions have been included in the PHC level service packages.
Let me, Doc, if you can just let me squeeze one last question so that you can cover it. Women leadership, because it's good that there is an established linkage between Pakistan's performance on SDG and the situation with SRHR. But how has the women leadership in SRHR made a difference to improve the health and well-being? We saw the video. That is telling a different story, and that is 80 to 90% Pakistan. So is there a disconnect, or is women leadership in SRHR able to make a difference? Does it make sense? Did you get that question?
Yeah, I was having some, I think, connection issue, but I've got your question. And you have rightly pointed out that, and I was basically also referring to the same vibrant women leadership in my first response as well. And we are really lucky to have highly influential women leadership that have basically harnessed the health sector over the last few decades. In my timeline, I had basically cluttered all those great women in the last 2 decades that have contributed to a very successful, I would put it this way, a very successful health sector performance in terms of slow but steady achievements towards SRHR. These prominent women leadership, they, of course, they are not limited to, but they include the first female Major General in the Pakistan Army, who was also the first female Director General of the Federal Ministry of Health, Dr. Shahida Malik. And then we have a global think tank who is a global name and enjoys a global repute for her contributions to public health, Dr. Sania Nishtar, who has been also for some time contributing to the Ministry of Health.
Right.
And we have a senior demographer and a lead, Dr. Zeba Sattar, and there are so many more names to just...
I think you have established the case. So we have a story. Now I would thank you very much, Dr. Qudsiya, for giving us a perspective on the how. Now I would like to request Dr. Shabnam Sarfraz. Dr. Qudsiya mentioned that there is a strong linkage between SRHR and achieving the SDGs. And women play a very crucial role as leaders. So we wonder how intelligently political and bureaucratic leadership in Pakistan uses evidence to guide program design and policy making to improve score on SDGs.
Thank you, Rob. I'm really glad this question is being asked, because there's a general, perception out there that at the policy level, the bureaucracy, even the political leadership, they make their decisions about programs and select, the interventions and the policies without any evidence in hand. There is a pertinent success story here, an exemplar of the responsive and intelligent leadership that you talked about, which I would want to highlight. It is what we had experienced, and after learning from, are in the process of actually replicating it at the federal level. This dates back to 2014 when the provincial surveys happened and which revealed dismal situation with immunization and skilled birth attendance. The government selected some of the poorly performing indicators in the health sector reform roadmap. This was a top priority charter. Highly specified province-wise reforms were introduced to address these dismal indicators. And some of the interventions which were brought in included skill building of the health workforce and targeted additional deployment where we were lacking the human resource for health, upgrading of health facilities where indicators were very poor, and also where facilities were not actually available to improve the accessibility. We benefited hugely through an IT partner within the government who helped develop digital monitoring and tracking systems, geotagging, microplans development, polygon tracking for the outreach workforce. And also this was supplemented through public facilitation with toll-free helplines, complaint cells. And also later on, we added a rural ambulance network to bring these women to the health facilities to improve the skilled birth attendance and the institutional deliveries. What was most important was that this was backed by an accountability mechanism. There were reviews which were done at all levels, and then in a quarterly high-level media hype and public roadmap stock-taking meeting used to be chaired by the provincial chief minister. And we witnessed these evidence-driven efforts paying off. I mean, when we had the next survey, we saw dramatic changes in the select indicators of the provincial roadmap, which were being reviewed and aligned on a very regular basis. In addition to political prioritization, there were stringent assessments and availability of real-time monitoring, as I mentioned, which enabled us to introduce timely mid-course corrective actions, which are very important in these large reforms when they're introduced. This was supplemented again with highly organized, coordinated alliances between the political, bureaucratic, and technical leadership, because you need all three if you want to see these larger reforms having an impact. Now that I'm at the federal level, we have introduced similar accountability hacks, monitoring programs, reviewing tracking progress and measuring impact, mainstreaming the SDGs. And now that we are developing the COVID-19 plans, we are alongside strengthening our monitoring capacities so that our reviews are evidence-driven and are much more targeted. So this provincial success story, it continues to be our sounding board, and it gives us a lot of hope that we'll be able to introduce similar structures in all the other, programs that we are doing at the federal level at the moment.
So that is extremely hopeful. Thank you very much for that perspective. And quite a few success stories we can see in there. Now, my last question, if you can quickly let us know, it's very difficult to escape COVID impact on SRH in Pakistan. I would really appreciate if you can tell us what has been the public sector angle, because everybody, all country is, they're engaged in COVID. It's completely been sucked out. So what is the impact of COVID-19 SRH in Pakistan, and how is the government tackling with it in the public sector? Has it not gone in the back burner?
It had like everything else, I would say. Initially we just thought it was just COVID, so all the health services, all the efforts just went on to that, and everybody felt that as this finishes, we'll resume work or we'll resume the services. It's just lately that that people have started coming to terms with that we may have to live with it much longer than we had anticipated, and we are looking at resuming these disrupted services which are across the board. SRH has been alarmingly affected, and this was by virtue of shutting down our outdoors where the clients would come in to get the services, and a lot of the facilities were actually converted into quarantine facilities and are continuing to provide those services. Then some private sector or even some public sector facilities remained open. There were lockdowns, the public transports were not available, loss of livelihoods, the poverty trap. This all has been, very, it has been very alarming, and we've just started working, we are putting together a national action plan for COVID-19 focusing on SRH. I've received the first draft, which is going to be a working document, and we will now start our consultation not only with the public sector counterparts at the provincial levels and the federal level, but also the private sector, because I feel that we have to take everybody along and optimally utilize the resources that we have in hand in order to address this, because we are expecting the unmet need for family planning to rise astronomically. The unintended pregnancies will increase because of this disruption, and this is going to have an impact on the high rate of abortions and the maternal morbidity and mortality, which we are very, very concerned of. So I hope that we will all together be able to, steer this and bring it back to as a high priority agenda as we move forward. But the work has begun, and we are going to be starting our consultations very soon on this with the provinces and then rolling out the plan.
Fantastic, fantastic. Thank you, Dr. Shabnam. It's been very elaborate. Now, we know that COVID has played havoc. The government is busy, like many other government, but government of Pakistan is no exceptions. Public sector dedicated facilities are dedicated to only COVID. Where do the people who became pregnant, the women who became pregnant 9 months ago, they are going to deliver on time. The abortions that had to take place are taking place at the same time. Chemists, pharmacists, shops, they were locked down. Distributors couldn't move. International suppliers of condoms and other commodities have clearly said that they will be out of production for so long. In this scenario, Dr. Yasmin Qazi, family planning, although we have established, makes a key component of SRHR, and people must have access to FP services as a human right. And family planning is also linked to achievement of SDG, as we just established. So, a couple of questions here, and especially covering the private sector and the donor mindset. So could you please tell us how the private sector and the civil societies created the conducive environment for the evidence-based models of the family planning and SRHR?
So if I'm understanding, if I'm understanding correctly, your question is about evidence-based models in any situation is it, but how does private sector does it? I think the kind of flexibility and the kind of edge that private sector has, that they are primarily innovative. They are not ready to, they're not afraid to take risks, and they can, I mean, the government would not do that unless they have proof of the concept very clearly laid out. So if there is a model that an NGO has established and that has given unusual results or good results, they are ready to scale that up. But if you ask them to do it as a first model, they may not be so comfortable in doing it because of their scale. So I think what NGOs, the private sector has an edge, that they can be innovative, they can try new pathways, they can take the risk, and they're not afraid of failure. So even if there are failures, then they feel that there is learning from it and how to adapt, how to be agile, how to come back. In Pakistan, like Kutsia was saying in our opening, actually family planning was started by a private sector organization, Family Planning Association of Pakistan, IPPF. In fact, they were the advisor to the government when they established the Population Welfare Department. So I think the entire family planning movement as a right to women to access and to have the control over her fertility and who have the control over her decision making was started by women leaders through civil society, and that was then adopted by the government. So I think still in Pakistan, if you look at the SRH and family planning landscape, it very much belongs to, as far as innovation is concerned, to the private sector and to the NGOs, to the civil society, who have always tried to bring the models in a different way and see how they can be successful. The delta is that whatever a private sector does, it has a limited scale. So unless it's not taken up by the government to scale, it may not be as, we may not be able to have those desirable results which we really want. So I think public-private partnership is the answer to this. So now we see a lot of openness in the last few years by the government. They do realize it's too big a problem. They can't do it alone. They have to do it with the private sector. If you look at the curative and the general side, in Pakistan, 70% people go to the private providers. In family planning, of course, it's more 65% goes to the public sector still, because family planning is still seen as something not maybe kind of a part of the general services, but the private sector has played a very huge role, the social marketing group like yours and other. So I think private sector remains a key. And I think even in this COVID situation, since you were asking that question, they have come quickly on the table. Like Shabnam was saying, the public sector was totally overblown. Everywhere in the world it was happening. It was not in Pakistan. Everything was diverted to COVID. All the healthcare providers were diverted to COVID. So it's not only family planning and SRH, nothing was happening except for COVID. But in our partners who are doing the project on the ground, they were very quick in coming up in a responsive strategy, coming up with a strategy, how to continue the services, even when the women are in the lockdown situation, how to reach out, how to bridge the gap on access. So I think that's the kind of, that's the kind of agility that the private sector has, which gives them an edge to really bridge the gap. And government has to realize that even in the situation of COVID, if the private sector can do it, they can also do it, but it's a matter of priority. Unfortunately, they do not consider family planning as an essential service in the disaster management guidelines, and we are really advocating for them to do that. There is a lot of things that are happening. I'm sitting in so many forums. Kutsia is here, she knows that. And we have really, really tried to bring it to the surface now. And we hope that, with our private sector partners, with champions in government like Shabnam is, Kutsia in the UN system, Kutsia and others are, we will be able to really have, but we want this to be sustainable, not that the next disaster comes, God forbid, and then we are again fighting from the same point where we stop. So I think it has to be a more sustainable way of approach and make them realize that women health can't wait. Women health can't be compromised. You can't expect a woman not to use contraception and then not to be pregnant. And then if she's pregnant and if she doesn't want it, what she will do. So I think these are kind of things have to be, but it also provides an opportunity to work very closely with the health system to see that it becomes a part of health system response. And we are hoping that it will.
So if I may start a supplementary question here, that in this crisis situation of COVID, when everything is down, private sector service providers are open, was there any between government and the private sector with respect to personal protective equipment availabilities or commodities, security, or introducing some kind of innovation? For example, Sana Press would have been forward, when the doctors are not available, or making the products ECP and misoprostol available at these service providers. So did you see some real efforts materializing on ground to come to the rescue of the women in Pakistan?
Yes, after the initial month of complete kind of a lull and nothing was happening, everybody was so panicked about COVID. And then, when all of us who are the advocates for family planning and SRH come together, and our partners have come very quickly on the board, now we see that there is a push. And of course, it might be very limited, but I think our partners are making sure that family planning providers have PPEs, they have the safety equipments which is necessary for them to continue the services, and they're trying to make sure of that. The support they may not have gotten from the government. In fact, government is expecting the donors to give them the support, which is fine because it's a very heavy resource intense calamity, and all of us as donors have been supporting government, but we have also allowed our partners, grantee partners, to repurpose their budget to make some room for this kind of personal. And the entire idea is that we are not forgetting and leaving those women in the communities unattended, and that we are not thinking about it.
It's
so that's
good to
the
see
whole
that.
idea.
Fantastic. I think you have put the perspective that public-private partnership, there is no other way except this, that you mobilize the already present infrastructure in the private sector. Thank you. Thank you, Dr. Yasmin. And now I will come to Lareb. Lareb, young women leaders in Pakistan have to take the legacy of all the wonderful work their seniors have done. Or you may say the baggage that they're carrying has to be accepted. Could you please tell us how are young women playing a role in this whole situation? Do they find themselves more or less empowered than their seniors were? Or how can the environment around young women, including families and society, be more empowering?
Okay. So first of all, I'll definitely talk about creating a very impactful platform for the young people. Unfortunately, I have seen a lot of places where young people are being called and they just sit there, be quiet, and they go back, take pictures. I think it's really, really important that we engage young people where they have a voice, where they have a point, and where they can at least have their voice in some decisions, which is actually the meaningful participation of young people. So creating a platform is very much important because that leads to the creation of ideas which are out of the box, of course. It's not like that nothing has changed. Definitely, a lot of things have changed over time. For example, if we see the strength of young women in universities, it's much more higher than the boys. But of course, we cannot be just limited to the metropolitan cities. We have to look for the smaller cities, what's happening there, because not only 3, 4 cities actually describe the whole country. But nonetheless, change is coming. It is gradual, it is slow. But there's just like one request, or there's one thing that's very much needed to the experts and the people who have achieved so far to keep on creating platform for the young people. And if they cannot create, then at least engage them meaningfully somewhere where they have something they can implement. Young people have a lot of ideas. I do believe they just look for a resource, can be a platform, which can be financial, but at least one platform. Because I have suffered from that where I had ideas, but then I also had to, go through this whole journey of finding the resource, whole journey of finding the platform where I could implement something. Yes, the environment badly needs to be towards the young women, whether I call it the policies in the workplace, whether I call it the policies to be selection on the quota basis, whether that's just a general environment for the newly born babies with their mothers. Whatever woman needs, we do need certain policies that would somewhere impact the work of young women. And we have a lot of examples. We share a lot of examples where they have babies in their offices and they're working, and we just encourage them. But I do believe that we still have a long way to go in Pakistan. We need to encourage women to work if they want, and the work in the way which they want. They should not be blamed or make some shameful comments that you have children and you're still working. So this blame game also somewhere, gives a very low morale, and it brings morale very down. Somewhere I feel like, okay, I'm working, I'm not here. So as I shared about the story in the last question that I just heard my friend's story about it. So I just want to share the presentation of that answer. So when she told me that she doesn't want to have third kid, and that's because her husband is somewhere in another country, and he just keeps on coming after 6 to 7 months, and that's because that country had some visa issues that she couldn't go. So I just thought whether I can create some sort of solution. That I said was also because of some people who made me feel like that it's not important to do 9 to 5 job, and you can create something. I can make a change. So with a very small idea, which I never thought would be like big or somebody would recognize it, I just created this mobile application that all of you can also see in the screen. Its name is Bridge the Gap. This name, and Yasmin also shared the word Bridge the Gap. Now this word is very much close to my heart, and that's because I just, connected the young people, the beneficiaries to the services, and we just act as the bridge. So this is, I think, one of the very crucial, very grassroots level problem that even the people who are living in the metropolitan area.
Fantastic. I think, Lara, you have given us a new perspective of innovation that has really come through. Since we're increasing the quality of information, if you will allow me, we will quickly jump into our final session, which is WISE. Is that okay?
Yeah, sure.
Fantastic. Dr. Kutsia, starting on the WISE, we have heard that we have achieved a lot, quite a bit in SRHR and SDGs. Women inclusivity is also there, but progress has been slow. So why is it that, despite continuation of democratic governments, investments by the international partners, more women inclusion than ever? What could be, the reason behind it? Kutsia?
Thank you, Dr. Aziz, for putting this question. And you are right in framing it this way that We have seen from our speakers in the earlier part of the discussion that there has been so much contributed towards SRH movement, but we are still seeing a very slow, sluggish progress. Pakistan was basically pioneer in various reproductive health efforts in the region. And I've mentioned about the family planning program and the lady health workers program. But there are factors that have basically led to keeping the progress slow. In my opinion, a main critical issue is the structural issue of existing dichotomy of the sexual and reproductive health service delivery between two government departments. There is a health department and there is a population welfare department. So somewhere in between these two departments, we lose the focus. Pakistan's family planning activities have been really divided in these. And if we basically look at the public sector outputs in terms of reproductive health, these two departments sort of interplay, but there is a very serious sort of interdepartmental, lack of interdepartmental coordination, which lead to inefficiencies and issues in implementation. However, I would like to mention here that this present government is making all the efforts to achieve functional integration. There is some movement going on, at least at the ICT level. There has been some real merger that has taken place, and we look forward to some more effective integration in the future.
Okay. I'll have to stop you there, Doctor, because now we have to have a breezy session. I get the perspective. Now I would like to give 1 minute to every speaker so that we are able to also have some question at the end. This is very important that Dr. Shabnam Sarfraz, Qudsiya just pointed out that several reasons for the slow progress, and being one of the few women in the leadership positions at policy, legislation, and strategies formulation level. What do you think is the most important thing to have inclusion of more women in decision making, especially in the wake of COVID for overall achievement of development goals? Very briefly, in 1 minute, if you were to, I know it's very challenging. So which new programs and policies in Pakistan considering for an equitable response to COVID-19, for example?
Thank you, Rab. I think it is extremely important, as we all know, that COVID-19 and the resulting socioeconomic impact has the potential to erode any gender equality gains achieved by the governments in the last few years. The circumstances have made the existing inequalities for women and girls even more wide and deep across the entire SDG spectrum. These inequalities are expected to increase because of gender intersecting wider structural inequalities. The government at the moment in Pakistan is taking a multi-pronged approach for an equitable response here, from supportive policy and legislation to responsive program design, necessary infrastructure and skilled human resource. We do see this as an opportunity for a more equal world, and we are all committed to fully exploit it. And to address this, we have taken, when we did our socioeconomic impact assessment, we had a special focus on the impact which was suffered by the marginalized and vulnerable population and took a gendered lens. And now also for the COVID-19 National Action Plan, we are trying to introduce gender indicators to all the different programs, if they are health, if it is education, having indicators around female students, giving specific quotas for scholarships for women, in the skill training programs, also in the social welfare program that I'm looking after, which includes cash transfer schemes and bank loans for securing the livelihoods. We are trying to ensure that we get the gendered, disaggregated data and indicators so that we are keeping a track of not losing our sight on the women who are hugely impacted in wake of COVID-19.
Okay. I think it's it's good to hear that it's not left out and government is already considering quite a few options, and it is. Then I turn to Dr. Yasmin Qazi. Dr. Qazi, while it is important that women take leadership position and at policy, legislation, the formulation level. What do you think is why do you think it's important for women to take, to be the change makers and leaders in the community levels? Because we started off with our story with a leadership emerging from a backward area, relatively underdeveloped area in Karachi. And a service provider was telling her story, and she was inspired by her mother, who was to be a sweeper in a hospital. Now her daughter is so why do you think it's important for these women to be the change makers and leaders in their communities and fields?
I think we have seen the programs that have worked with the community women as community leaders. Although the framing is lady health workers, I've always said, if we can call them lady health leaders, then they feel more inspired and motivated, because for me, they are the leaders in the community. Because we always think that leaders are somebody who's sitting at the top and who are doing, all the, they are also leaders. But I think the real change makers, the one who instigate the change, and we also have our partner doing Marvis, which is again low educated woman who does the same job like lady health workers does. But we feel that the women, when they are mobilized, they are motivated, and when they are empowered, first of all, they can connect to the other woman very easily, because they also go through the same sexual reproductive health issues in their life. And they realize that when they had no support system and when they had nobody to go to, what kind of difficulties and challenges they have faced. And they ended up having large families and, not being able to send their children to school, and the woman having, a lot of health issues. So I think women, when they are mobilized and when they're able to connect, they can really be a change maker. So it starts from the community, it go to the middle tiers, it involves all the young people like Lareb is here. And then of course, sitting at the policy maker side, I think having Shabnam, having Dr. Sania, seeing those women at the top is so gratifying, because, they are the one who would really understand the issues, and they would know how to influence the policies and how to make that change. So I think it's very important that we have more decision makers at the top level. We have seen 2 provinces have health ministers who are women, and they are definitely more quick in taking decisions. They are in their understanding, in the way they respond. So I'm not saying that the men would be bad leaders, but what I'm saying, especially for our field, the sexual reproductive health and for family planning, the women leaders definitely play a very, and then of course for the balance, for gender equity, for optics, you need more women at the top positions, because you want to have that power balance, and you want to have women who is always there to raise the issues which may not be seen by men sometimes. So I think it's important. Over to you.
Thank you, Dr. Saab. Now, Lara, if I can come to you, as we just discussed, it seems that leadership is not an event; it's a process or evolving process to increasingly inspire a larger number of people who start doing what they should be doing. So, why is that young people do not feel they are part of the process? Why is that young women who have all the potential to lead usually are taken as too smart or too impulsive or too strong-headed in Pakistan to be given more decision-making role? Your perspective on that?
I would say it's only patriarchy, and patriarchy, because, when there's a man who is wise, he's smart. And when there's a woman who's wise or too energetic, she's too, wise or too emotional to be at a position. So I would never say that in this way. I think men or women, both are equal to me, both are equal as leaders. But yes, I wouldn't say that young people do not consider themselves as a part of the process, but linking my last question that I really wanted to just wrap up, actually, because it connects the answer with that there was just little one solution that I thought may be, useful, but somewhere in my mind, I never thought that it can be impactful. So, just talking about our expert panelists just shared about IPAS, about the PWD departments, about FPAP, all those organizations, it was such a huge honor that they actually came to me. Now, here I think that at times it's just in our minds that we have, platforms, the hurdles, the obstacles that are in our minds, that the story we have heard always about that elephant who is, used to of thinking that I cannot do it. So at times I did some things, and then when I got the result, I was blown away that, okay, Green Star is, asking me to be in the panel. Of course, it means a lot. Then, FPAP is asking me to do their geotagging, if etc., because they are at very high level. So this proves that leadership again is not someone or for someone who is, sitting at government. It can also be through a youth-led initiative. So young people definitely consider themselves a part of the process and they want to, but there's only one thing needed. And that's just about the platform, meaningful participation without patriarchal connotations to certain, you could say, positions or certain conditions for the women. But yes, for the young people, I also believe that there are a lot of cultural sensitivities that are important. For example, if I was talking about, Ma'am Yasmin also shared her experience, I talk about SRH all the time. And I get a lot of tags for that as well, that it's an agenda, it's the Western thing, we do not have it, why are you talking about it, it's something shameful. So especially when you're taking something out of the box, and then you're talking also about those points which are taken as cultural sensitivity, it becomes double, you can say a double way, a double problem that you have to deal with. But the only point is going on with the passion and just keep trying, that one day people are going to understand. I think I got to that point, and today I think this platform shows it.
Excellent. I think before we wrap up and ask our speakers to give one-line messages to wrap up, let's revisit the woman that has brought us to this forum. Unless and until we are able to unleash the tremendous potential at the grassroots level that exists in the ecosystems of the community, probably these issues will never be addressed. Sana, can I request you to let us know what our community mobilization, what's happening there?
This is a communication leading behavioral change in her community. As part of Green Star's social marketing's interpersonal communication team, she visits house to counsel women on health-seeking behavior and family planning. Lovingly called the Sitara Baji, the community star by women, Saima has won the hearts of her community.
शुरू में जब मैं यहाँ काम करने के लिए आई तो मुझे बहुत सी मुश्किलात का सामना करना पड़ा। लोग मेरी बात सुनने के लिए तैयार नहीं थे, मुझे अंदर नहीं आने देते, मुझ पे भरोसा नहीं करते थे। आहिस्ता आहिस्ता मेरी बात समझने लगे, मुझ पे भरोसा करने लगे। फिर मैंने उनको फैमिली प्लानिंग की अहमियत और फ़ायदों के बारे में बताया कि बच्चे की सेहत और घर की खुशहाली के लिए माँ का सेहतमंद होना ज़रूरी है। जब माँ सेहतमंद रहेगी तो उसका पूरा घर सेहतमंद रहेगा।
Young leaders like Saima are working against the tide, building their network from the ground up. They have fought tooth and nail to make their place in the communities where they work.
सितारा बाजी बहुत अच्छी है। सितारा बाजी हमारे घर आके हमें फैमिली प्लानिंग के हवाले से बताती थी। उन्होंने हमारी बहुत मदद की फैमिली प्लानिंग के हवाले से। सितारा बाजी मेरे घर आई, मुझे बताया मिलने वाला इंजेक्शन यूज़ किया सितारा बाजी के कहने पर, जो हम किसी से पूछ नहीं सकते थे। सितारा बाजी आती थी हमारे घर, हमें बताती थी, हमें गाइड करती थी। सितारा बाजी अब मेरी बहुत अच्छी सहेली बन गई है।
The incredibly tough role Saima plays cannot be undermined, working in tough conditions to counsel women for birth spacing. Young community leaders like Saima are truly a beacon of light for their communities.
Thank you, Sana. Now, to wrap this our session, I would very request our speakers to give one-liner, and I'll start with Kutsia. Dr. Kutsia, one-liner message that you would like to give to this international audience who is with us here.
Sure, Dr. Rab. I think as a single most important strategy. Yeah, can you hear me?
Yes.
Hello. Yeah,
yes,
so as a single most important strategy, I think introducing career ladders for women in the health sector from top to bottom is surely an important requirement. We have to have women leaders emerging from the grassroots. We have seen so many influential leaders at the top level, but we need leaders to emerge from the grassroots level. And our father of the nation has said, no struggle can ever succeed without women participating side by side with men. So we need more women leaders, definitely. Thank you.
Lared, your one-liner. Thank you, Dr. Kusia. Lared, your one-liner.
Okay, so there will be many people telling you that you cannot, and every time you have to tell them that I can and I will. So just keep trying always, no matter what people say. You have to do it, and nothing is impossible for young women.
Fantastic, fantastic. Dr. Shabnam Sarfaraz, may I request you, madam, to let us have your view before I request Chair to close the session?
I think I didn't unmute myself. I would like to share translation of small poetic verses by a renowned Pakistani poet Fahmida Riaz that I actually did this last night for a lovely Moldovan friend. People will tell you to learn to compromise. Others will scare you that you may lose all you have. Such things have happened. However, you must remember that the moment you are living in today is the moment that is alive only because of you.
Wow.
You will never find this moment again. So go ahead, do what your heart always wanted to do, all what had been left undone. This is your moment. Don't let anyone, any thought stop you. Leap forward and just make it happen.
Wow, just straight from the heart. It's so
I cannot express it as good as you would have in Urdu, I know that.
you have done a marvelous job. It's straight from the heart. Now, it's here to invite the chair of the session, Dr. Yasmin Sabi Kazi. Dr. Kazi, if you can sum up our messages in a way, it's a very difficult thing, but I know you can handle it. Over to you, madam.
Well, there is a lot of takeaways from the discussion today. I don't think so we have time to go through the entire summary, but I think what has been a very prominent message is really about, coming from the young girls to the one who are already established women leader is one thing, is about the commitment, the passion, and the resilience. And, what Shabnam was saying in the end, I was also had that one tagline that I would like to ask all women out there to dream big. No, people say, don't, why do you do daydreaming? I think you should dream all the time. You can only achieve go high, and you can only achieve big when you are dreaming high. So I think this is the kind of a vision that you need to have. This is the kind of a belief you need to have. And we have heard about that women in Pakistan, despite of some very challenging socioeconomic and social norms, they have found the way and they have really risen to the top. So the message is that when there is always a silver lining, so we should not be always looking at the dark side, but having positivity and having a belief will make the change that is required. I'll stop here.
I think, Dr. Saab, thank you very much. I'd like to thank my panelists, Dr. Uzma Kutsia, Madam Dr. Shabnam Sarfaraz, Lareb Abed, Dr. Yasmin Sabi Kazi, and of course, Brigitte, you have been fantastic, and the International Leadership Academy for giving us this platform. We are going to, I don't think that we have time for question and answers, but it has been an honor for us to be able to present a case, Pakistan case, as a case study of the work that has been done around sexual and reproductive health and unleashing the tremendous potential that exists in the women in the ecosystem. So with these words, I thank the audience, I thank the participants in the session, and hope to contribute a little bit for the good of women of Pakistan in general.
Thank you everybody.
Thank you so much.
Thank you.